Hello, my name is Dr. Greg Symko, and why, if you're taking thyroid medication for your thyroid that doesn't seem to be working very well, and you still have symptoms. Now, here's what is very interesting about the thyroid gland. The medication you take for the thyroid gland is actually only treating one type of problem. The medication has something in it called T3 or T4 or both. Now, this is okay if your thyroid gland is not producing T3 or T4. And on the other side, it's okay if the system is not working to make the T3 to do its job. Now, the problem is that the thyroid gland is just a piece of the whole puzzle. Now, what is basically the system, how it works, is that you have something called the hypothalamus. Now, the hypothalamus is found near the brain stem, or in the brain. Then you have something called the pituitary. Now, some of you may have heard of pituitary, hypothalamus, whatever, but the hypothalamus influences the pituitary gland, it's a gland, to secrete something called TSH, or thyroid stimulating hormone. What does that mean? It stimulates the thyroid gland to do what it's supposed to do, and that's to produce something called T4. T4, excuse me, is a hormone that is a precursor or something that is inert. It doesn't do anything other than get transformed into something else. So here we have, let's step back a minute, we have the hypothalamus, the pituitary gland, and then the thyroid gland. Now you can see that you can have problems in the hypothalamus, the pituitary gland, or the thyroid gland in order and to have a problem in how your thyroid works. So let's go a little further. So the thyroid gland produces T4, then that T4 is changed into something called T3. T3 is the substance that actually makes everything work the way it's supposed to. That's why Synthroid, which is T3, actually is pumping in this into your system to make things work. Now, there's another step to this, is T3, okay, is actually then has what's called receptor sites, or like plugs in your electrical outlet. It plugs in to these sites to make things work the way they should. So you have how many places? You have the hypothalamus 1, pituitary 2, the thyroid gland 3, then you have the transfer from T4 to T3. So that's 4 areas that there could be a problem with your thyroid gland. Now, Synthroid, or like medication, takes care of only 1. So if you don't know what those other 3 are doing and taking Synthroid, you might not solve the problem. Now, TSH in and of itself is not a very good way of determining the health of the thyroid gland, because if you were to take a series of TSH readings, thyroid stimulating hormone readings, by drawing blood, you would find that it can go up and down, up and down, up and down, naturally. So you see that it's not a good indicator. So what has to happen? Well, you have to investigate those other areas. It takes more than just one blood value. And so you have to find a physician that knows what to look for. And it's actually simple. There are about 10 markers that are associated with the thyroid gland, 10 things that you need to look at. And this is a simple blood test to see if the thyroid gland, the whole system, is working the way it should. More than just one. So 1/10 is looked at, typically, to determine if the thyroid gland is a problem. And it's based, and a lot of medication is based on that 1/10. So you see that there's more to it than just TSH. There's more to the thyroid gland than just the thyroid gland that needs to be looked at. So I implore you to find a physician that knows what to look for, and stop getting off the merry-go-round of these symptoms you're experiencing, and finally get to the grassroots as to why your thyroid gland is not working the way it should.